First rule of aviation, don't ever pass up a ride in a Stearman. Good afternoon, it's Matt here with Semper Fly. My last video I talked about a lot of the light sport rules and how that applied to flying an aircraft like a Piper Cub. And I got some questions about the medical processes and the medical things that you need to have to fly this airplane. So what I thought I'd do in this video was talk about your basic 3 different options for how to get a medical to fly this aircraft or an aircraft like this. As I mentioned briefly in the other video, I fly this airplane under light sport aircraft rules. I talked about that in the other video about how much it weighs and how many seats it has and things like that. Obviously a Piper Cub is light sport. Light sport medical certification rules allow you to fly an aircraft, act as pilot in command, as long as you have a valid driver's license. I, of course, have a valid driver's license here in Florida. It doesn't have any medical restrictions on it. If your license does have medical restrictions, then you do have to comply with the medical restrictions on your license. However, before you go off barreling through the sky on your driver's license, you do need to be aware of one paragraph that the FAA regulation has regarding flying under a sport pilot. And I'm just going to read it. If a pilot knows or has reason to know of any medical condition that would affect his or her ability to operate a light sport aircraft, the pilot should refrain from acting as pilot in command. What are the types of conditions that the FAA says you should be aware this might affect your ability to act as pilot in command? Well, the regs have a list, and it's about a dozen or so, and I'll read just a few of the more common. Angina, coronary heart disease, a cardiac valve replacement, a permanent cardiac pacemaker, diabetes, psychosis, bipolar disorder, any other personality disorder that is severe enough to manifest itself in overt acts, substance abuse, epilepsy, disturbances of consciousness, or the loss of a central nervous system function. What the FAA is saying is they're putting on you the knowledge that if you have any of those conditions, or broadly any other condition that a reasonable person would think would affect your ability to act as pilot in command, then you should not be flying an airplane. I suppose there are people operating under light sport that say have diabetes, and the reason they're operating under light sport is because they know that if they go to a doctor and get diagnosed with diabetes, that would ground them under the third-class medical rules, so they just play ignorant and fly under a light sport. That is a violation of the rules. Light sport allows you to fly under a driver's license as long as you still conform to the FAA regs of grounding yourself if you know you have a condition that might affect your ability to act as pilot in command. And just to avoid some of the arguments, the FAA lists things that I just mentioned that they say, in case you didn't know, these things affect your ability to act in pilot in command. So if you suffer from one of these conditions, you should not act as PIC even under light sport driver's license. The second type of medical classification I'm going to talk about is what's called BasicMed. BasicMed came about in 2016 and pretty substantially changed the way to get a third-class medical to fly small aircraft such as this. The basic requirements for BasicMed is you must have a valid Florida driver's license, like we talked about in light sport. You must have, at one time since 2006, held an actual FAA third-class medical certificate or higher. So whereas light sport, you never had the requirement of having a medical certificate, under BasicMed, you had to have at one time had a third-class medical. Another condition of light sport is you can only fly if your third-class FAA medical was never suspended, revoked, or denied. So if you went in to get a third class and it got denied, you can't then say, well, I'll just go buy a Piper Cub and fly on my license. You can't do that. So unlike light sport, where you could get into light sport and fly without ever having had a medical, under BasicMed, you had to have at some point had an actual FAA third-class medical. As with light sport, you can fly under BasicMed if your most recent third-class medical was not denied or revoked for some reason. So again, if you had a third-class medical and it gets denied, you then cannot go fly under BasicMed. You would have to clear up the denial on your third class before you could do that. Under BasicMed, you could fly an aircraft with up to 6 seats, 5 passengers, and up to 6,000 pounds. So your basic 4-seat Cessna and Piper is going to be allowed under BasicMed. You also can fly either IFR or VFR. Light sport is only VFR. As I mentioned with light sport, there are disqualifying conditions that will not allow you to fly under BasicMed. The process is allowed where you can get a special issuance. A special issuance is where the FAA deems that you have a possibly disqualifying condition, such as you've had a heart attack. They might make you go to additional testing and additional process through various doctors to get approved to fly. The FAA can then approve that under a special issuance. You can fly it with a special issuance BasicMed as well. To obtain a BasicMed medical certificate, you have to go online to an FAA website and conduct a training class that takes about an hour, and also fill out a health questionnaire. It's quite a few pages. You then print up that questionnaire and you take it to a doctor. Now, this is one thing where it's different between a medical certificate I'll talk about in a second. You don't have to go to an AME, a Certified Aviation Medical Examiner. You can go to any licensed physician. So you can go to your own primary care physician and he can fill out the paperwork. Since BasicMed, there's been a great deal of discussion about what doctors will sign these BasicMeds and not. I asked my primary care physician back when this first was becoming an issue, and I said, would you sign this FAA form since you do my annual physical? And he was a little bit hedgy, and he basically said he'd have to see the form and he'd let me know then. But I can see a situation where your primary care provider might not feel comfortable signing FAA forms he doesn't really understand. But you are allowed to take this questionnaire form to your primary care physician, have him fill it out, and that qualifies as your BasicMed. What a lot of pilots do is they still take their BasicMed certificate to an AME, an Aviation Medical Examiner. He's more familiar with the forms, and that's usually a pretty quick process. Well, how is this different than a third-class medical? Well, you don't have to do it as often. First of all, you have to do the online class every 24 months, but you only have to get the examination every 4 years, which if you're over 40, a third-class medical is every 2 years. So if you're like me, you're over 40, you would only have to go through the BasicMed process every 4 years as opposed to every 2 years. I guess there's a bit of a cost savings in there. When I was getting my last third-class medical that I had back about 2018, I asked my AME that I was going to what his opinion of BasicMed was. He basically said that he was still waiting to see how it was going to flesh out, but he had some concerns about signing off on a BasicMed certificate for somebody who was not an ongoing third-class medical patient of him, like I was. So he said somebody like me who had gone to him a couple times for medical certificates, he would have no problem completing the BasicMed paperwork for me. However, if somebody just came in off the street with the BasicMed paperwork, he probably would not be interested in just signing off on their paperwork. He would want to be a little more involved in the process, such as if he was issuing a new third-class medical. So there's not really any difference in what the doctor is doing from that perspective. But that probably varies from doctor to doctor. You might have some doctors who give you the see lightning, hear thunder test and you're fine. Other ones might be a little more involved. And again, it also is going to depend on what your personal relationship is with your primary care provider. Maybe your primary care provider is a pilot and he's aware of these forms and he has no problem with it. Mine wasn't a pilot and he was a little unsure if he was going to get involved in the BasicMed process. It's important to note that that paragraph I read earlier about the known condition affecting your ability to operate as a pilot in command applies to BasicMed as well. If you have a condition that you think you shouldn't be flying, then you shouldn't be flying under BasicMed either. The third category I'm going to talk about is your traditional FAA third-class medical. The FAA has 3 classes of medicals, first, second, third. I'm not going to talk about first and second. Those deal mostly with commercial operations. But third-class medical used to be the only way to do it prior to about 15 years ago when they started changing the rules as far as light sport and BasicMed are concerned. The procedure for a third-class medical, you contact an AME, an Aviation Medical Examiner. You make an appointment, you go in, he conducts a brief examination. He gives you a form to fill out, which basically lists your entire medical history. And then he'll go through your medical history and he'll do a brief examination. He'll take your blood pressure and you'll do an eye test and things like that. And then he'll determine if you're eligible for a third-class medical. If you are not eligible for a third-class medical because you had one of those conditions that I read out earlier or something else he finds, and that medical certificate is denied. That is significant because once it is denied, you are no longer eligible for either basic med or light sport once you had one denied. If you get a medical certificate denied, you can go through an appeals process with the FAA, or more commonly what he'll do is he won't issue the certificate, but he'll forward the documents to the FAA for their determination. They can then deny it or give you a special issuance or have you do additional testing. And here's where the real crux of the matter involving these different medical processes come into play. And this part of the video is my only opinion and how I've seen it work at my airport. There is a perception among pilots that it is easier, or you can fly under a condition with the light sport or even basic med that you would not be allowed to fly under an FAA third-class medical. That's not really how the regs are written. If you shouldn't be flying under light sport, you shouldn't be flying under basic med, you shouldn't be flying under FAA medical. The oversight into checking your condition is a little higher with a third-class medical than it is with basic med, and then even more so than with light sport. So the FAA is putting it on you to somewhat self-certify yourself as being eligible to fly. And I'm sure looking around my airport here and anybody who's involved in flying, I'm sure you've seen people who said that guy probably couldn't get a medical if he went in to get one, so he buys a Piper Cub and he never has to ask anybody for a medical. Well, that FAA paragraph I read before still applies to you. So there are some people that sort of ignore that paragraph and say, as long as my license is valid, I'm valid to fly. It's not really how the regs are written. However, there obviously is the perception that there are more people flying under basic med that were not going to be flying under third class. Back about 2015, when I used to own my Cessna 172, I had gotten that airplane right before basic med kind of got kicked off. And then when I sold it, it was somewhat after basic med had gotten kicked off. And I used a broker up in the Midwest who's a very big aviation broker. Anybody who's into buying or selling airplanes has heard of these people. They do a lot of aircraft sales. And I got to know the one guy pretty good because I'd call him up every month and say, hey, I'm thinking about buying a Cub or I'm thinking about buying that. We'd sit and talk about it. And one of the things that he said to me was that the price of Skyhawks 172s and Piper Cherokees and the like were skyrocketing. They were skyrocketing because there was a whole bunch of people now looking to buy a Cessna 172 and fly it under basic med when they were not under the impression that they could fly under getting a third class. Well, given how the regs are written, that's not really possible. The only way that's possible is if the person is just ignoring a condition that he probably knows he shouldn't be flying with, but since he doesn't have to actually go through a third class medical procedure interview, he's not really worried about it. That's not really safe, and that's not how the regs are written. However, that has been a result of what's happened. So why does a person want to go through getting a third class when you could also fly under basic med? Well, there are some reasons. If you want to fly out of the country significantly, you probably need to have a third class. Not everybody accepts basic med. Now, I'm down here in Florida. I understand the Bahamas accept basic med and light sport, but I don't think Mexico does. So if you want to take your airplane and fly it down Baja California and stay at Cabo for a few days, you probably are going to need a third class medical certificate. So you don't have the restrictions about the number of seats or the airspeed that you do with light sport and some other things. So depending upon what your airplane is, if you have a Beach Bonanza and you want to load it up with 5 people and fly off to Cabo, well, you might need a third-class medical certificate. However, for an airplane like this, like what I talk about on this channel a lot, you don't really need it. Now, I could get a third class. I had a third class. My last third class didn't expire until I think a little over a year ago was when it expired. And I don't really have a reason to re-up it because what I'm flying I can do under light sport, but I have no doubts I could go in and get a third class medical. My primary care provider is the same guy as who my AME was. So I have a pretty good idea that there's nothing that would come up. However, I think there are a lot of people out there that are unsure if they'd be able to get a third class. So if they used to have a third class before they had a heart attack, before they got diabetes, before they had some other issue, maybe they just say, well, I'm not going to risk it. I'm not going to go get a third class. As far as I know, I'm fine to fly, so I'll fly under basic med. Or even more so, I don't know for sure that I have diabetes. I've never asked my doctor that. Or I don't go to the doctor, so I don't know that I have diabetes. I'm just going to buy a Cessna 140 and fly under light sport. There is a risk to that. If something happens, you have an incident and the FAA comes in and they find out that your doctor told you 3 years ago you had diabetes and you were still flying on your light sport, they're going to consider that flying without a license. They're basically going to consider that illegal. So there are some risks here. I wouldn't go off into light sport if your real concern is if I go get a third class, I'm going to get denied, so I'll get a light sport. It's not really the FAA's intent. The light sport and basic med saves you some money over going to get a third class. You don't have to go to the doctor as often, and the process is not as complicated, so it saves you a little bit of money and saves you a little time. That was the intent under basic med and light sport. The intent was to not allow you to barrel around in your Cub when you shouldn't be in the airplane, and that's not what it's there for. I hope that helps clear up a few things in there. If you have any questions, put them in the comments down below. I am by no means a medical expert, but I've gone through the process of third class, started to do basic med when I got the Cub and realized I could do it under light sport. So I'm a little bit familiar with the rules there. I hope that helps you make some decisions if you're going forward getting an airplane like this. They're a blast to fly. So in the meantime, if you like the video, hit subscribe and keep flying. Thanks for watching.